Hello, my name is David Trimberger, and this is my first peer-to-peer attempt at direct adult intubation. First thing that I want to do is gather up all of my materials. I want to make sure that I have the properly fitting ET tubes. So normally for your standard size adult, you would want about a 6.5 to 7, 8 for larger or smaller for pediatrics. Using with what I have, I currently have an 8. I have my Mac blade that I want to make sure works. Okay, the light came on. Check it one more time. Light came on. And make sure that I have proper PPE, capno. I have my additional tubing set to the side, suction, my BVM, and oxygen. So first thing that I want to do is pre-oxygenate my patient. I already have my patient on high flow oxygen at a nasal cannula. I'm going to go ahead and connect them to an SpO2 monitor. I'm also going to put on proper PPE. And I'm going to go ahead and connect my BVM to oxygen as well. I'm going to manually open their airway. If I see any secretions, then I will go ahead and suction out the airway, no longer for 10 seconds, only on the way out. I'll come over and insert an OPA. And then I will ventilate my patient at a rate of 10 to 12 times a minute. I'm checking for adequate rate and volume and adequate chest rise. And then I'm going to take note of my SpO2. If it is above 94%, I am going to cease my ventilations, and I'm going to get ready to intubate my patient. Okay. So I will remove my adjunct, and then I'm going to prepare my ET tube, grab my Mac blade, inspect the airway one more time, see if there's any secretions. Then I'm going to put my patient in a sniffing position. And then I'm going to take my Mac blade, insert it, lift up, inflate my cuff, remove my syringe, remove my stylet, and then I'm going to make sure that the ET tube was advanced to the proper depth, take note of how far my tube was advanced, and then I'll begin to start ventilating my patient. Once I see that I'm getting adequate chest rise and full, then I'm going to go ahead and auscultate my lungs as well as auscultate the epigastrium to make sure that I have proper placement and that my tube is at the proper depth. I am then going to remove my BVM, attach a secondary confirmation device such as capno, go ahead and connect capnography to my monitor, continue to ventilate my patient, and then I'm going to monitor my, I'm also then going to come over and stabilize my ET tube. I'm going to continue to monitor my patient for any signs of hypoxia, and then I'm also going to watch capnography and the SpO2 to make sure that it is staying within normal ranges. And then for the second part of this skill, it is going to be to determine suctioning for my ET tube. So what I'm going to use to symbolize suctioning is I would want a flexible suction catheter. And so what I would do is I would go in and I will insert my suction device, and then once it's in, I will cover the end of my tubing, then I will suction, and then I will remove and do that for no longer than 10 seconds. yet again while monitoring for signs of hypoxia, and then continue to ventilate my patient. And I will ventilate my patient for 10 to 12 times a minute, monitor vitals, and notice for any signs of patient condition. Thank you.